Hey everybody, it is Kevin Henry, Editor-in-Chief for DrBicuspid.com. Thank you so much for joining us for this episode of the DrBicuspid.com podcast. Thrilled today to be joined by a colleague of mine and somebody who's doing a lot of good things out in the dental industry right now, and that is Dr. Kianor Shah. Dr. Shah, how are you?
Great, thanks for having me on the show.
Hey, glad you're here. I know about you because you and I have worked together for quite some time, but let's let our audience know a little bit about you before we dive in today.
Okay, I'm a general dentist of 19 years now, and I practice part-time, and the rest of the time I spend on various enterprises that we have built with our fellow colleagues over the years. And I've seen you on these conference floors for the last 2 decades on a regular basis. And you're very active also in the industry. So thank you for what you do.
Hey, absolutely. Thank you for what you do, because I know you have a big event that is coming up very soon, and I want to make sure our listeners and viewers know about.
Yeah, we have the 2025 Doctors World Gala coming up in Sardinia, Italy from June 12th to 14th. We do this every 2 years. Our 2023 event was a great success and we had outgrown it, so we moved the venue to Forte Village, which is a top world resort. And it's going to happen in about 3 weeks, and we are almost at max capacity. The last count I had was a little bit over 700.
Fantastic. Coming off the International Dental Show, whenever I was in Cologne, I see the value of different parts of the world coming together to discuss the industry and what's going on. What do you see as the value for different parts of the world coming together to talk about dentistry?
I think even artificial intelligence, robotics, globalization is more important now than ever to collaborate with our colleagues. We learn things from YouTube, from Facebook. Nobody knows where they're being uploaded from, but there is sort of an interrelationship now between all of these doctors, and we kind of understand what is good quality dentistry versus what's substandard. And there seems to be a consensus across the world for most of these procedures. So there's never a scenario where it's bad to intercollaborate with colleagues, and I think having more of these type of meetings, I think there was over 150 countries participating in this one, and bringing all these ideas and concepts together creates a better environment for us. There's only really one right way of doing a filling or a crown, but all these local municipalities and regulatory bodies have sort of complicated this. It shouldn't be this complicated, but we really thrive of networking, and that's what makes the world go around,
You talked about the growth of this meeting, and is it the networking and collaboration that really has fueled the growth behind it?
Yeah, so what started as the world's top 100 doctors with a small group of people shortly before COVID hit us has grown into an international sensation now, operating in over 160 some countries with our constituents in different areas. And a lot of good projects come out of it, and we enable them. The ecosystem continues to grow, and now we're getting involved in standards and other things. So very exciting times, but persistence has brought us here, and the love of education. Doctors love education, continuing education. That tends to bring us together. So when there are no barriers to that, you find yourself in an environment where there's a lot of collaboration on many other things too.
So I do want to talk to you about a couple of things that are in the news, maybe on a worldwide basis. And I think dental hospitals is something that is gathering some attention right now. And I know you've got some opinions and some views on that. And I tell our readers and listeners what they need to know about dental hospitals and where are we going with this concept.
I was reading an article yesterday about the Chinese having built a medical AI hospital and has seen 10x the number of patients, increasing access to care. Good idea. What we don't have in dentistry is an environment. Say you're a medical doctor and you're getting ready to go into a heart surgery. You're talking to the radiologist. You're looking at path reports. You're communicating with various departments. We don't have that really in dentistry. We're kind of isolated. Let me give you a scenario. Right now you have an emergency on a Saturday. You go to a local emergency room, take up an emergency, but they're not equipped to treat you. They give you antibiotics and pain medication. You go home. On Monday you come to the dentist says, oh, this tooth, I can't save this tooth. This is a root canal. I don't do root canal. Sends you to the RCT guy. And the endodontist says, well, this has furcation involvement. It has to be extracted. Off to the oral surgeon you go. And this is circle goes on with tremendous amount of waste, and the taxpayers pay for it. Imagine having one location where we have all the specialties and we have 24-hour emergency room where we can attend to these things, and we're equipped there's a lot more collaboration there. And with artificial intelligence now, I think it's time. So we're in the process of actually building a tooth-structured dental AI hospital. It's shaped as a wisdom tooth with all the 11 different specialties and an emergency room that's accessible 24 hours a day. And I think it's going to be a tremendous service to the public who will have access, a lot of collaboration between doctors, and a lot of waste reduction. So it's been a hot topic going on now, creating these dental AI hospitals in our ecosystem.
And as these hospitals are being built or being conceived, shall we say, you mentioned AI. Is the hospital able to keep up with the amount as fast as we're moving forward with AI?
Yeah, that's going to be always a challenge, the way things are going, but we will certainly deploy the latest technologies in there to be robots, screens, a lot more animation, holograms that help with consents and education, patient education, things of that sort. So we're trying to keep up with it. They're popping up everywhere. It's sort of the wild, wild west. But there is a positive that comes with AI in terms of diagnosis and making things more efficient for dentists. But patients still want to have the human touch. So we're going to have doctors and staff members, but more focused on customer care and overseeing the processes. But once you build it and you properly build it, you can constantly exchange the new technologies and equipment that come in. This facility is to be a self-sufficient, energy self-sufficient facility involving hydrogen as well as it's going to be something very unique, like from the future. There's a water stream that's going up and you feel like you're sitting in a waterfall essentially, and it's cleaning also the solar panels and not overheating the facility. And lots of meetings, lots of discussions about this stuff, but we're very, very excited. There's one earmarked for LA, one for Dominican Republic, Punta Cana area, and one for Riyadh in Saudi Arabia.
Very nice. Now that's an exciting development. And it feels like we've talked about the oral systemic link forever. And it feels like that this could be the next evolution of that to make sure that we're really focused on everything that we can do to let people know why oral health really is important for everything in their body.
Bingo. You know, oral health is your first line of defense outside of your skin, and it's known to be the dirtiest body. It's known to be connected to just about every organ, and there's a big gap between the medical and dental professionals. The tides are going to be turning because with predictive analysis and AI, you're most visited by patients. Twice a year they come in. They give us data and it goes into predictive analysis. It can analyze what kind of medical conditions you're going to have down the road. So we can be a very instrumental part for preventative medicine in the future, given the fact that AI is in play and we're the ones that are seeing these patients usually on a regular basis versus the medical doctors.
When we're talking about oral health, I want to get your opinion as a clinician and somebody who is in touch with everybody around the world about the topic of fluoride. I know that this is a very hot topic in the United States. Where do you see this going, and what are some things that you think your colleagues need to know?
I think let's put the research aside about its benefits or its negative outcomes. We have to also consider patients' rights and the right of the public. In majority of the countries, fluoride is banned for a host of reasons. My biggest issue with fluoride is its unconsented medication of one's water supply. I think people should have the right to choose what goes into the water supply. Another problem I have with it is being ingested. When you're drinking a glass of water, you're not sitting there swishing it around your mouth trying to get the fluoride out of it to benefit your teeth. It goes down your esophagus and down your stomach, and then it ends up doing whatever it does to other organs. So those two things are issues that I consider, putting aside that there might be plenty of research to support that in low doses it is safe, although I don't know of any other poisonous material that's safe in low doses to the human body, but it's said that it's safe at a certain percentage. So we want to look at those issues, and just based on being a doctor and requiring consent for my patients for everything I do, I think there's an issue with essentially unconsented medication of one's water supply. And that's what the current health secretary is discovering to see if the positives outweigh the negatives. But then, there's always fluoride supplements that one can do if it's in their belief that fluoride is going to help their teeth get stronger. It's a very, very sensitive topic. I always love to look at the data, but we also have to respect the right of autonomy of the public.
Do you anticipate this being a hot topic at your upcoming meeting?
It's going to be discussed. There are certain task force groups being put together to really look at the science. Some claim it to be the biggest achievement of our time, the public water fluoridation. Some claim it's a neurotoxin. The minute you start talking about it, people get very sensitive about it, depending on what their position is. So we'll look at it. There's got to be some kind of a consensus between the doctors, and it's going to remain a hot topic. I believe Florida just announced that they're going to cut it out of the water, and the governor's position was that it's ultimately should be people's choice, the consent issue.
Well, we've talked about the meeting. Let people know where they can learn more, and if they're interested in a trip to Italy to collaborate with their colleagues, where they might find out more information.
congressaio.it is the official site for the Congress, as well as the Gala, where you can buy tickets for that. The Congress portion is close to 40 CE units of AGD, ADA, FDI, you name it. So it's mostly for the American crowd that's going down. It's a nice tax write-off to take the family down and get this off your bucket list. And the other website is top100doc.com regarding the Global Summits Institute and our operation now there.
Both those links in the show notes. So if you're watching this on Dr. Bicuspid, it's in the article. If you're listening to this on the podcast network, check the show notes and you'll be able to link very easily. So Dr. Shah, always good to see you, and look forward to running into you again very soon.
It's my pleasure. I've been with you guys since dental school, and I really appreciate this outlet, Dr. Bicuspid. Thank you.
Absolutely. And thanks to all of you who've listened to this episode of the drbicuspid.com podcast. As always, we appreciate your time, and we wish you nothing but success.